This case is an example of dysphagia in an atopic adolescent. A 16-year-old girl presents with progressive difficulty swallowing solid food. She has a history of asthma and allergic rhinitis. Endoscopy confirms eosinophilic esophagitis. What is the most appropriate treatment? Proton pump inhibitor alone, propranolol, systemic steroids, esophageal dilatation only, swallowed budesonide. The correct answer is swallowed budesonide. Explanation: eosinophilic esophagitis is an immune-mediated disease. Topical swallowed corticosteroids as budesonide or fluticasone reduce eosinophilic inflammation. So the diagnosis here of an adolescent, the most common diagnosis of an adolescent with dysphagia or difficulty swallowing, with dysphagia, along with a history of atopy, asthma, allergy, okay, along with a history of atopy, and the endoscopy confirms eosinophilic esophagitis. So this is eosinophilic esophagitis. The most common diagnosis is eosinophilic esophagitis. Can be confirmed by endoscopy. The most appropriate treatment is swallowed topical corticosteroid. Topical swallowed corticosteroid as budesonide or fluticasone. So let's talk about eosinophilic esophagitis. A 45-year-old man with dysphagia, patient with dysphagia to solid and liquid. He describes feeling food stick in the mid-chest. Okay. So, what are the radiographic findings of eosinophilic esophagitis? This is double contrast esophagogram shows tapering of the proximal esophagus, narrowing of the proximal esophagus, okay, or narrowing of the mid-esophagus, and the narrowed portion has concentric rings, okay. So there is narrowing of the mid-esophagus, and the narrowed part has concentric rings. This is the barium tablet. The barium tablet is seen lodged at the proximal esophagus above the narrowed segment. The prevalence of eosinophilic esophagitis is greater now. Okay. One of the most common causes of food impaction in the young adolescent. So, eosinophilic esophagitis should be suspected in young adolescent with food impaction and history of atopy. typically affects the young adult between 20 and 40 with an allergic history or family history of allergy. Most patients complain of long-standing dysphagia, frequent food impaction. The findings on barium are often diagnostic, but maybe subtle. How to confirm? By endoscopy. Esophageal strictures are the most common radiographic finding on barium swallow. So esophageal strictures are the most common finding with ring-like indentation of the narrowed segment, producing a ringed esophagus. The rings or strictures may be of varying length. The goal of the management of the treatment for eosinophilic esophagitis is to relieve symptoms of dysphagia by topical steroids, swallowing topical steroids, maybe along with proton pump inhibitor. Eosinophilic esophagitis is inflammation of the esophagus with characteristic infiltration of the eosinophils. So there is esophageal infiltration by eosinophils. This is the cause of eosinophilic esophagitis. This leads to the most characteristic imaging finding is concentric esophageal strictures. Concentric esophageal strictures on barium swallow, ring esophagus. Most of the affected patients have allergy or food intolerance history. So, allergic history or food intolerance history is very important for the diagnosis of eosinophilic esophagitis. Biopsy of the esophagus is required for definite diagnosis. So, endoscopy and biopsy is required for definitive diagnosis. Okay, as we mentioned here, this patient, in this patient, endoscopy confirms eosinophilic esophagitis. Endoscopy and biopsy confirmed the eosinophilic infiltration of the esophagus. Okay, so how to confirm eosinophilic esophagitis? By endoscopic biopsy. How to treat eosinophilic esophagitis? Responds well for steroid treatment, for swallowed topical steroid.